Kiss it. Ah.
That's me, Ellie James. And that's my dickhead boyfriend. I mean, he's alright. Just your average college student, brushing their teeth, going to class, eating at the caf, and enjoying the final remnants of childhood. And I almost forgot. I have trichotillomania. What's that? So basically, I pull my hair out.
Trichotillomania is an impulse control disorder where the patient has recurrent, irresistible urges to pull out hair from the scalp, eyebrows, and other areas of the body, despite trying to stop.
Mostly from my eyebrows and eyelashes, but also from my hairline a little bit as well. And it's not just like tweezing. I mean, everybody does that. But I'll keep picking until my face is bleeding and I don't have any hair left and it doesn't grow back.
It's a body-focused repetitive disorder on the OCD spectrum, similar to excessive skin picking, nail biting, and cheek biting.
It does not have to be my hair. It's anything that doesn't feel right, so if I can feel a scab or a pimple or anything like that. But for the most part, it's definitely my hair.
People with trichotillomania will get a feeling, or itch. And like any other itch, the longer you try to ignore it, the more apparent and irritating it becomes, until you can finally scratch at it and relieve that horrible feeling.
If you want to know what it feels like to resist the urge to pull, imagine resisting a glass of water after you've been stranded in the desert for 3 months.
Ellie began pulling excessively when she was about 15 years old. It began as a bad habit, but became uncontrollable, until she had virtually lost all the hair from her eyebrows and eyelashes.
So the first time I can remember taking my hair out for a reason that wasn't just like trimming your brows or whatever, was one summer. My parents are pretty strict, so I was like in the house all the time. And I was so bored that I literally just plucked all the hair out of my legs. Like it was something to do. And from then on it kind of just like became something I'd do when I was bored. And then something when I was stressed. And then it kind of just didn't get better.
The turning point of her hair pulling came when her brother was diagnosed with cancer while she was in high school. Ellie began picking more and more often at that point. This was a very stressful situation for everyone in her family.
Both my favorite and least favorite part of getting ready is putting on fake eyelashes. So here we go.
Ellie began to withdraw socially and had a hard time focusing in school. She would escape classrooms to run to school bathrooms and pluck her hair to gain a sense of control over the situation.
During this time, her mother allowed her to see a counselor for her sudden shyness and worsened grades. However, when Ellie's counselor mentioned her hair-pulling behaviors, her mother pulled Ellie out of counseling and blamed her for letting a silly habit get to her. Her mother refused to help her decrease her pulling and only punished her for her behaviors.
Ellie's lack of a caring environment ultimately worsened her pulling until she would pull constantly throughout the day. She would pull both unconsciously during periods of boredom or stress, but also as a focused activity that includes plucking tools, mirrors, and excessive evaluation of the hair.
When I was younger, I tried to stop picking by wearing mittens over my hands and covering mirrors. But you can't cover the mirrors at school or even wear a hat in class, so there I was unprotected and couldn't do anything to stop. I was starting to do badly in school and even got in trouble a few times for leaving the classroom. I guess the fact that pulling my hair had become such a huge part of my life really got to me, and nothing I tried really helped. But now, figuring out what makes my hair pulling worse or even causes it in the first place has been the biggest step towards controlling it.
Many patients with trichotillomania will receive cognitive behavioral therapy and habit reversal training.
HRT, or habit reversal therapy, is where Ellie is able to define, monitor, and remove the certain stimuli that cause her to pull.
A way that Ellie can do these things is by writing down a log of conditions surrounding her when she is picking. She can get the urge to pick in very specific situations, such as seeing herself in mirrors,
Phone screen, TV screen, laptop screen, the microwave screen, windows, car windows, shiny surfaces.
If Ellie has a way to distract herself other than pulling, she can reduce her activity. This can be done by using fidget devices or playing phone games.
Some people with trick eat their hair, but I don't do that as much. I used to do it more when I was younger, but we did find out that my aunt has Trich because she had an emergency surgery for a blockage in her gut, and it turned out to be basically a big ball of hair.
Hello and welcome from your friendly neighborhood trichobezoar specialist, Dr. Flynn. Due to Ellie's presenting concern of trichophagia, or eating her hair, she is at risk of developing a mass tract in her gastrointestinal system called a trichobezoar. This mass, or hairball, forms because the indigested hair cannot be adequately digested. Sometimes these hairballs can be relieved through vomiting, but in large-scale cases, such as her aunt's, these masses must be removed surgically. Thank you. Signing off from Dr. Flynn. Meow.
Drug therapies are commonly ineffective alone, but are recommended alongside other treatment methods. Because there is a high comorbidity rate between anxiety and mood disorders with trichotillomania, antidepressants such as selective serotonin reuptake inhibitors are commonly prescribed. I would recommend an antidepressant, such as Prozac, to be prescribed to Ellie.
Side effects of Prozac include nausea, upset stomach, constipation, headaches, insomnia, drowsiness, aggression, appetite changes, and sexual dysfunction. Even after years of therapy.
Relapse is extremely common.
This affects everybody. Ellie may have a Trich, but we're all dealing with it.
Before you fix something, you have to take it apart. Messes are bound to happen, but you gotta focus on the cleanup. Does that mean go?